about who we are going to listen to today. We have senior colleagues on the call, I am told. All right. So today I'm excited to host this friend of mine. He's a brother. All right. He's very excited. He's passionate about what he does. He's into more education, health promotion, prevention, and all that. He's very, very hardworking. All right. And he holds an MPhil in clinical psychology. Of course, after the BSc medical science, he holds an MPhil in clinical psychology, and he's a qualified medical doctor. And on top of that, listen, on top of that, he's a member of the West African College of Physicians and a member of the Ghana College of Physicians. What that means is that this young man is both a specialist psychiatrist and a clinical psychologist. Do you know what that means? There's no other person more qualified than him to delve into the topic and the discussion today. Please, without much ado, help me introduce to you Dr. Emmanuel Atuesinya Azusong as he delves into the topic orgasm. Doc, your audience.
Yo, thank you very much. You pass hype, man. This one, forgive you, Mike, make it a hype people. Charlie, thank you very much for having me here today. Sexual issues is something that I'm very passionate about, and it's unfortunate that a lot of doctors and healthcare professionals do not want to delve into sexual issues, and we relegate it to the background for the street drug peddlers and for herbalists to concern. But I feel that when it comes to sexual dysfunctions, there are no other people to better understand it than medical doctors. And that is why I am particularly keen and interested in this particular area to see how we can improve the sexual lives of people. So like Dr. Sedo here said, today our topic is going to be orgasm, and sex is so broad. I'll try my possible best to restrict the discussion on only orgasm. But of course, there will be time for questions, and with questions, and once you bring out your questions and I can answer, I would do my best to answer. So this is basically going to be the outline of our presentation. I'm going to briefly tell you about the anatomy of the sexual reproductive cycle, the anatomy of the sexual reproductive organs, and the embryology, what actually is sex, the sexual cycle. And then we'll come to the topic of interest, orgasm, the types of orgasm, and the physiological changes that would occur in orgasm, and how one can reach orgasm. So as a starter, I would want us to know that the sexual organs first appear in I hope everyone can see my picture.
Yes.
So the sexual organs first appear in utero at about 8 weeks. And you would see that there are presence of certain things we call mesonephric and then paramesonephric ducts, which are here. And we have what we call the sex determining factor, which is what is usually seen in males. But for a start, all persons are born female. But then those that have this sex determining factor would then be converted into males. And it happens in utero at the beginning of at 8 weeks. And so you have these structures here, and then these are the internal ones. And this is what happens in the male. And on the right is what happens in females. And so basically males and females have the same structure until birth. So we have the umbilical cord here, which would usually turn into the genital tubercle. It is the genital tubercle in females that then protrudes. This genital tubercle we are seeing is what is going to become the penis. Please, can you see my cursor?
Yeah, I can see it. I can see it.
Yes, yes, you can see my cursor. Yes. So this genital tubercle is what is going to gradually develop into the penis in males, and then it will develop into the clitoris in females. Then you have the labia majora and then the labia minora in this particular side. Like I said, we are all born females first, but this labia minora on the outside closes, and then the labia majora as well also closes. And when it closes, in the male, it will form the scrotal ridge. So you see that if you take the scrotum of every male, there is a small, tiny thing. You can see that there is actually a connection. It is the two labia majora that closes to form that. And then in females, on the other hand, you would have the genital tubercle growing to become the glans clitoris. And then the vagina would then begin to open. So it is basically the same thing that you would see. So the clitoris is the equivalent of the penis in the female, and then the scrotum is the equivalent of the labia majora and the labia minora. We have the tubes, what we call the paramesonephric and the mesonephric ducts, who then grow within in the internal structures to form the fallopian tubes and then the ovaries. And so at birth, this is what you would see. The third picture, at birth, you would see that all of these structures are formed. And then once the two labia majora form, that small tiny ridge you will see in your scrotum, which is the raphe of the scrotum. So finally, this is what we would see in the female after you have the main changes occurring. And I would want us to take note of the structures, because an understanding of the genital structures is very important in getting a satisfaction during sex. Because if you know where the structures are, you know the right spot to hit, you know how to stimulate the woman or how to stimulate the man in order for the person to reach an orgasm. So in the female, you have the uterus here, and then just at the end of the uterus, the tip of it is the cervix. And the cervix actually extends, it's longer here, but then this is just the opening of the cervix. And then this opening of the cervix is also very sensitive, as it has nerve endings. And when we start talking about the various types of orgasm, we'll talk about the cervical orgasm, where this is that particular structure that will be stimulated by the penis in order to cause a cervical orgasm. Then you have the vagina in here. Let's take note that the vagina in an unaroused female is a potential space. So it is flattened until the person begins to have the desire, is aroused, is in the excitement stage. Then the vagina, that potential space then begins to open. And for every female vagina, you have these, what we call these regions, they are called ruga. And these ruga are what, when you have the thrusting of the penis inside, it causes extra stimulation of the penis to increase the person's sensation. And this small section over here, the posterior fornix, we would come to that, and then I will show you. We also call it the O spot. It is also an area, an erogenous area, very, very sensitive. Then in the internal structures, this is how the uterus is usually lying. It lies on the bladder, as you can see over here. But then when a female is excited, it gets elevated. So once the female is excited, it gets elevated into the greater pelvis. This area is the greater pelvis, or the false pelvis. And the essence of this elevation is to ensure that if you look at how this opening is, when sperms are coming, it will be very difficult for the sperms to go in. And so you have an elevation around this particular area. So there will be easy passage of the sperms through the cervix into the uterus to cause fertilization. Then you have the bladder, which is here, and the urethra, which is also here. And then this is the vagina that you can see. And like I said, it's a potential space. So in an unaroused female, it is flattened until the person is aroused, then it opens up and then what? Elongates. Then we have the breast as well. And the breast is also an area of that is very sensitive and homogeneous. And so you have nerve endings terminating at the nipple over here. And when I talk about the various cycles, we will see the changes that occur in this particular area of the breast, the nipple, and then the areola. The areola is the darkened, you see darkened and small, if you like, small bumps around the nipple. Then the external genitalia of the female, you have the mons pubis, which is usually the small hair that you would see. And then the clitoris, which is inside here. Later on, we'll talk more about the clitoris, which is usually just seen as an iceberg because it is deeper than what the eye can see. And then you have the urethral opening here and the vaginal opening here, and then your labia majora and minora. So basically, this is after you have the changes in utero. Once the person is developed, this is what you would see in the female. On the other end, the male, this is what you would see finally. It produces and becomes the external genitalia that you see. And over here, you have the bladder, and then this is the prostate gland. You would usually have, during orgasm, you would have, so there are some seminal glands here, with Cowper's glands and things. So you usually have small fluids that are released through this particular duct into the urethra. And it allows for the sperms to be able to move freely. This same corpus cavernosum and then corpus spongiosum is also in the females as well. And then we have the testes here and then the epididymis, which is usually surrounded. So in the female, all of this is what you would see as the labia majora, and then the inner part would be the labia minora. And here is what we call the glans penis. This structure here. This glans penis is the equivalent of what you see as the clitoris. But the clitoris, in addition, has a clitoral hood. In the male, it is the same as, it is the prepuce that we, after circumcision, you would cut the prepuce to expose the glans penis. There are some theories that say, in fact, the name penis stems from, has its origins in Latin and in Greek, and they call it the tail or the hang, which shows that our penis, in fact, is like a tail, or it is hanging and pendulous. So some people say that if you circumcise, it decreases your extent of stimulation because of the conification that goes in the glans penis. Conification, I'm talking about the area becomes a bit scarred and is exposed to hair and all of those kind of things. So the epithelium becomes thickened. But research has shown that, and there are no tactile changes in a circumcised penis and an uncircumcised penis. So that's myth that when someone circumcises, then the person is likely to have lesser stimulation. It's not true. So now let's come to the sexual response cycle. There are basically 4 main steps according to Masters and Johnson. So it says that the steps start from the desire. You need to first of all have the desire of wanting to have sex, and then you move on to the excitement phase, and then to the stage of what? The plateau, orgasm. And then there's another phase here, which is the resolution phase. So we would see what happens to the individual parts of our body during excitement and then during orgasm. And as you can see, there are various types of the sexual response that can occur. This is what happens in females. So in the A, the person gets excited, and then the excitement begins to increase, and then it reaches a plateau. Then there is a sharp and a sudden increase in the excitement, which causes this peak, and then it suddenly declines. In females, they can have multiple orgasms. So as soon as a person reaches orgasm and is in the refractory phase, you can immediately stimulate the person to get another orgasm. And studies have shown women who get as much as 5 to 10 orgasms in one sexual cycle before you then come to the resolution phase, where the person is in refractory. And then all the various changes that were occurring in the person's body goes back to normality. In the B phase, in the B type of sexual response cycle, once the person is in excitement, it goes, the person does not really get an orgasm, but there are peaks and troughs of the excitement in the plateau phase, and then the person goes into resolution phase. And this is what happens in a lot of women. In fact, studies show that about 70% of women never reach an orgasm. The other phase is the C phase, where you have the excitement, it goes quickly, the person gets into an orgasm and then quickly drops into the resolution phase, where you would see mostly in quickies. Because once the person reaches orgasm, immediately goes into the refractory phase. This is what is usually seen in males. That is why I didn't show a picture of what occurs in males. So in males, once the person ejaculates and releases the semen, it goes into the resolution phase. And it takes a while before the person can get another erection. And this period is variable. So now let's go to the individual phases and see the changes that occur in the various parts of the body. Sex, as we know, it begins in the mind. And so at the excitement phase, you have various chemical changes that occur. In fact, you have release of several neurotransmitters that will stimulate the person and even give the person the motivation and urge to want to have sex. And that is where it starts. Men are described as gas cookers because they are stimulated by all the senses, most especially the sense of what? Vision. So a man sees a woman who is very attractive, has the figure that he wants, and immediately, just like a gas cooker, gets excited and very quick. Women on the other end are like the electric stoves because it takes a long time before they get excited. And so on the skin, you would notice that there's usually a maculopapular rash. This is very obvious in people who are light-skinned. And it starts around the abdominal area. If you notice it very well in people who are light-skinned, you will see it, and then it extends to the upper part of the body, to the chest, to the neck, and then to the face. You would see that in a woman, most of the time, there would be a flash. And you will see that's when you say that somebody is blushing. And what's the reason for this? The reason for this is because of the blood flow. Because during the excitement phase, there is an increase and a rush in blood flow to the various parts of the body, causing the person to be blushing. And so you can look at a woman and know that the woman is interested in having sex or is not interested in having sex. The woman is excited just by looking at the face or not. Some people have tend to even bright and their skin tend to glow. And in some people, they may have small amount of perspiration, sweat around their facial area. Then in the penis, you have a rush of blood flow to that particular area, which is usually by the sympathetic autonomic nervous system, to be specific, the sympathetic area. And it causes the blood vessels in the penis to engorge. The picture I was showing you earlier about what we call the cavernosum and then the spongiosum, it's like a cushion. That's when you fill with water, it becomes what? Heavy. And that is what happens to the penis. So the penis becomes erect. And this erection is as a result of what? Blood flow to that particular area. The person gets excited. And during the orgasm phase, the erection of the penis even increases. The average penis, as we know, is about 9 centimeters when it is flaccid. But when it is erect, it can go as high as 13 to 14 centimeters. And some people estimate the width and girth of the penis to be about 5 to 9 centimeters when it is fully erect. And so it does not really matter the size of the penis. The size of the penis does not determine whether you are going to have a satisfactory sexual intercourse or not. The most important thing is to know the areas in the vagina or the areas in the female part of the body to stimulate. And when we talk about the vaginal orgasm, I would explain that more. And the rugae that I showed earlier in this part of the rugae can cause a person to be well stimulated. Then you have the scrotum. The changes that would occur in the scrotum is that the scrotum becomes also engorged with blood. It elevates and it can increase to about 50% of its normal size. And during the excitement phase, once the penis is enlarged, you have the blood vessels compressing on the nerves in that particular area. And so if after a very long period of time, the person does not release, then blue balls will then begin to form as a result of the dilated blood vessels compressing on the nerves. That will later on then begin to now start causing pain. And that is how come people would usually develop what we call blue balls. And in Caucasians, you will see that the area becomes a bit bluish. And so the name, blue balls, coming from the engorgement with the blood vessels. And then in the Cowper's glands, which I showed you, that is closer to the prostate, you would have it releasing seminal fluids that will then join the sperms to allow the sperms to swim freely into the cervix and into the uterus. Another very important change that you would see in excitement in the men is you have an increase in norepinephrine that would cause the sympathetic changes. So when we talk about the sympathetic changes, we are talking about it is akin to someone seeing a lion and is ready to either run away or to fight the lion. So you have elevated blood pressures, you have elevated heart rates, you have the person panting and breathing excessively. And it's also been shown that one part, there is squeezing of the nasal region. So you will have, so airflow would not move in freely. That is something that was, recently found, which would also cause the person to be more, to have like, to become breathless. And during the orgasmic phase, there is loss of muscle control because the person is unable to control the muscles. And in males, once I showed a picture in here, and I would want to explain that more. During orgasm, once the seminal fluid from the carpus and the seminal glands are released, you have engorgement in this particular area, slight engorgement in this particular area. This slight engorgement is usually felt, and that is the feeling the person would have, like, I am about to come. And this would last for usually about 3 seconds maximum. If you are able to feel that sensation and remove your penis, or better still, decrease the stimulation, you would what? Delay ejaculation. But if you are unable to decrease the stimulation of the penis around that particular period, then what happens is that the prostate begins to contract involuntarily. And once the prostate begins to contract, it pushes and spurts the sperms from the epididymis and the vas deferens to join around here. This is where it joins into. And then it joins through the urethra. And at that particular point in time, you cannot what? Delay ejaculation. And in young males, the sperm can reach a distance of about 17 to 20 centimeters. Just that sperm. That shows how strong the contractions are. The strength of the contractions also come from the muscles around this particular area. So we have here, there is something we call the coccyx around this particular area. And then at the front here is the pubic. You cannot really see it clearly here, but there are muscles that line through this particular region. And these muscles we call the perineal muscles, or the technical name is the pubococcygeal muscles. And it is like a hammock. You see, it's like a hammock around that particular area. So all of these muscles would contract involuntarily, and the person is unable to control it, because once it begins to contract, it is out of your voluntary control. And so it is through that contraction that causes the sperm to come out at that particular speed. But as a person ages, the speed of of reach of the sperms decreases. And by the time the person is about 70, 80 years, you would have sipping of the sperms instead of it spurting with a lot of energy. So very important for us to take note. In delaying orgasm, once you feel that sensation prior to ejaculation, if you are able to decrease the stimulation, because you are about to get to the peak, and once you decrease that stimulation, then you can delay ejaculation for a small period of time. And if you delay the ejaculation for a small period of time, you would still reach the peak again, but the peak is going to go higher than before, and which will cause your final ejaculation to be more pleasurable and more exciting. So it is very important for us to take note of that particular change that occurs prior to ejaculation. So now in females, it's the same thing that happens in the mind and in the skin, the glow. Then in the breast, like I said, the breast size increases to about 25% of its original size. And it is also filled with blood. The nipple area, the nipple becomes erect, because some people say that the nipples have erectile tissue. Although this is debatable by some, they say that the nipple has erectile tissues. And so the nipples become erect and stand, and you would notice their erection. But after resolution, they then fall. The areola area is the darkened spots around the nipple, which also become engorged with blood. And once they are engorged and erect, they are more sensitive. And so extra stimulation around that area will only add up to the total stimulation and pleasure that the woman would feel. Then the clitoris, like I said, it is just like the penis. I will show you a picture of the clitoris vis-a-vis. So this is the clitoris, and this is the penis. There is actually no difference. All of this particular area, just like the way you would see that the penis becomes engorged, all of this particular area of the clitoris also becomes what? Engorged. But this part, this area, is not visible to the external, it's not visible externally. It is inside. And so once it becomes engorged and you are stimulating and focus only on the glans penis, you would miss the boat, because extra stimulation around this particular area also adds to the sensation that the woman is feeling. And once you have extra stimulation, then the woman is likely to reach that peak of orgasm. We would come to how to stimulate the clitoris and the best way to stimulate the clitoris. But then what I want you to take note of is that during the excitement phase and during orgasm, all of this particular area becomes engorged. And then just right before a woman reaches her orgasm, the clitoris, the glans clitoris that was initially erect will retract into the clitoral hood, and you will see the clitoral hood somewhere around here. So the clitoral hood is here, and then just right before orgasm, the gland clitoris would retract into the clitoral hood. And at that particular point in time, if you are stimulating, you may not find the clitoris. But if you stimulate the areas around the labia minora and the labia majora, the person would continue to get that extra sensation that you need in order for her to reach orgasm. And in stimulating the clitoris, it is very sensitive. So you first of all have to start with a back and forth motion. The motion needs to start with light pressure, and as the sensation, the person begins to feel the sensation, and as you feel it becoming more erect, the frequency of the back and forth increases. And if you are stimulating and you focus on only what is outside, you have to use your thumb as well, because if your index finger is around here doing the stimulation, your thumb can go a bit up around this particular area and also stimulate this particular area to cause the person to have extra sensation. Or your index finger can push a bit further to locate the erect clitoris to stimulate the person to get extra sensation. And so that is what happens to the clitoris. That is what happens to the clitoris during excitement and then once orgasm reaches. Then the labia majora in women who have not given birth before. Interestingly, this is what happens. The labia majora will elevate and get flattened towards the perineum. So it moves closer to the perineal area. But in women who have given birth before, the labia majora gets congested and edematous. So you can feel it very well, and it will be very heavy. And so you have to know the lady that you are dealing with and where to find the labia majora during the period of the excitement phase. And the labia minora can increase to about 2 to 3 times its size. The color changes to pink, and then just right before orgasm, the change becomes what? Deep red in the labia minora. And this is what happens to the vagina. Like I said earlier, it's a potential space, and this average size is about 9.6 centimeters. God is so wonderful. He created the potential space of the vagina just to be about the average size of the penis. And so you can have no thing like, oh, this penis is too big and it is not going to enter. Granted that it is even big, once you are excited, the vagina it balloons up. And then what? Apart from just ballooning in wave, it also what? Elongates to about 2 times its size during the excitement phase to cause you to have extra stimulation. Then the color of the vagina will change to dark purple. And then once arousal happens, you usually have transudates that are produced. And it is these transudates that the woman begins to feel as a sense of wetness. So a lot of women will be able to tell that I am aroused because there is some fluid that is coming out from me. This fluid, the transudates, is clearing the vaginal space, ensuring that the place is, how do I call it? The place is wet enough so that the friction that would occur as a result of the thrusting does not cause erosion of the vaginal walls. And this is what happens to the lower third of the vagina during orgasm. It will constrict. And a lot of men would feel that as the woman is holding my penis with the vagina. And women can perfect this act by strengthening the muscles around that particular area, which I initially stated looks like a hammer, the people coccygeus muscle, strengthening the muscles around that area and hold the penis tighter to cause extra stimulation around that particular area. And during orgasm, the lower third of the vagina and all of the various muscles around that place would begin to contract rhythmically. So you would experience about 3 to 15 contractions per 0.8 second, less than 1 second. So you can imagine the extent of the contractions. The uterus, like I said earlier, will also ascend. So the uterus is lying down on the bladder. And then during excitement, it lifts up. And during orgasm, it contracts. And the contraction is like labor contractions. And there are some women who have these contractions during their menstrual period, and they contract to the extent that the contractions would cause orgasm. Then the rectum would also contract, and all the muscles around that particular area would begin to contract rhythmically. So, ladies and gentlemen, these are the physiological changes and the things that you would notice during orgasm. And all of these sensations are felt in the brain. And so the person would have a subjective sense of what is happening. So now we'll move on to the various types of orgasm and how to achieve the various types of orgasm. So like I said, the common one and the one that everybody knows is the orgasms are named based on the area that is stimulated to cause the orgasm. So you can have clitoral orgasms, you can have vaginal orgasms, you can have cervical orgasms, and then you can have a combination of all of these things. Some studies also say that there are anal orgasms, there are also throat orgasms, there are also nipple orgasms just by stimulating of these particular areas. Now to the almighty clitoris. And this is the deception that we have all been faced with. And a lot of people do not know the extent and nature or structure of the clitoris. And sadly, in our medical books, medical anatomy, you scan through, you go through anatomy of the female reproductive, but you never really see the structure of the clitoris as it is here. And so this is how the clitoris looks like. So if you want to stimulate the clitoris and you focus only on the glans clitoris, to the neglect of these particular areas, the vestibule, this is the vestibule, and then this is the crus clitoris. And then there is usually a small cover around here, which is the clitoral hood, which is the equivalent of the prepuce or the foreskin in males. So this is the equivalent, as you can see. And so if you want to obtain a clitoral orgasm, in fact, a lot of women achieve orgasm by self-stimulating or by masturbation than during sex. And this is also another area of concern where you have other females stimulating their fellow females, either with their hands or with their mouth, what we call cunnilingus, or with their mouths in order for them to achieve orgasm. And our ladies are running away because they have never achieved such types of orgasms with their partners or with their male partners. And so if you are a male and you do not want to go down on your woman, or you do not want to cause extra stimulation to the clitoris of the woman, then you may be missing something very, very important. And you may be denying your partner of full pleasures of sex. I earlier on stated how you would stimulate the clitoris. You first of all start by doing a swelling and then a gentle back and forth as the person gets more stimulated, evidenced by her appearance, evidenced by the kind of sounds that she would make, evidenced by how she also touches you back. You would gradually increase it. And you would also notice that the size of the clitoris would also be increasing As the size of the clitoris is increasing, you'll be able to locate the shaft of the clitoris in order to continue your stimulation in that particular area. And then use your other fingers to stimulate the vestibule and the crus, which you would find in the labia minora and labia majora region, or better still, the lips of the vagina. So once you do all of these things, the person can get a clitoral orgasm. Ladies and gentlemen, that is it for the clitoris. So know the clitoris and enjoy your sex with your partner. Then we have vaginal orgasm. Vaginal orgasm, as the name implies, is achieving orgasm through vaginal penetration. And I would want to state this and tell you the various parts of the vagina. So, like I said, here you have the potential space, which is the vagina. And then these rough edges are what you call the rugae of the vagina. Then there is this part. Can you see my arrow?
Yes, yes.
Very good. This part is the anterior fornix of the vagina. And over here is the posterior fornix of the vagina. This area here is called the A spot. And the name is coming from the fact that it is anterior. And then there is this area, the posterior fornix, is called the O spot, which is coming from opposite of the anterior. These areas are very, very sensitive. And this small ending that you are seeing here is the cervix. And so if you are having sex with your partner and you are able to reach this particular areas, the person is likely to get extra stimulation and reach orgasm. How can you reach these areas? Obviously, size helps, but size alone is not the exclusive determinant of reaching this particular area. If you understand the anatomy and the woman bends down and gives you a doggy, what it happens is that it opens this particular area well and gives you an easier reach to the cervix and to the fornix. And so if you are trusting, you have to trust strategically and know where you are trying to aim at. Once you are able to locate this particular area and notice that the woman is having extra feeling in that particular area, you stay there and continue. Once you stay and continue and keep doing it at a higher frequency, the woman is likely to reach an orgasm. This area, which is the opening of the cervix, is also very sensitive. And it is this particular area that sometimes when you are trusting, the woman has given you, your partner has given you doggy, you are trusting, then the lady will begin to feel a sudden pain. That is the cervix that you usually hit. And so if you hit it so much, the pleasurable feeling can turn into a painful feeling. But if you hit it rhythmically and at a frequency that the woman enjoys, the woman is likely to reach an orgasm. And this type of orgasm would be called a cervical orgasm. And notice the area of this particular thing. This is the uterus. And all the connections that it has around this particular area through the nerve connections. Once you reach a cervical orgasm, it can transmit to all other parts of the body. And that is when you would see that women are having orgasmic seizures, where all parts of their bodies are what? Are shaking. And this area is very, very powerful. So positioning is important in locating this particular area. The size of the woman is important. Fat women, it's more difficult to locate this particular area if she is lying down. And so you would have to change your position. Even if it is doggy, doggy becomes more difficult because of the size of the buttocks. It becomes very difficult for the penis to reach that particular area. And so you would have to continue to change the person. You can lift the leg up into a reverse missionary position and then reach this particular area. The other part of the vagina which I would want to show you is the highly controversial G-spot, which is located here. G-spot is located around this particular area. The name G-spot comes from Dr. Ernst Grafenberg, who was the first to actually locate it and scientifically prove that, yes, this particular area is different from the other parts, the other anterior wall of the vagina. And so let me show you clearly over here. So if you insert your fingers into the vagina, you insert your fingers into the vagina like this, and then lift them up slightly. You need to go at least 2 to 3 centimeters inside, and then squeeze your fingers up this way. You'll be able to locate the G-spot, and the ladies can try it themselves. This particular area is bulgy, like a bag of worms. And microscopically, it's been shown that there is what we call ganglion. So a ganglion is an accumulation of nerves that are located in this particular area, which makes it very, very, very sensitive. And so if you're having a perineal penetration and you locate this particular area and trust well around that particular area, and this is the key. The key to reaching an orgasm is to locating the spot where the person is getting the most feeling, and then continue to trust rhythmically in that particular area until the person reaches orgasm. And this area, you have the uterus, the urethra, which is just above this particular area. The urethra is just above here. And so once you continue to stimulate in this particular area, what happens is that the place becomes engorged, and then fluids are released. And because the urethra also has a mixture of its urine, the fluids in this particular place that are released, and if the person reaches orgasm and the contractions of the perineal muscles begin to occur, what happens is squirting. And so you would notice the woman squirting, just like a man ejaculating and squirting sperms. And so the woman would also squirt the fluid that would come out from this particular area. And squirt fluid is also mixed with what? With urine. But it is not what? Entirely urine. So this is the G-spot, which you would find right around here. And if you stimulate it very well, you can get a G-spot orgasm. If you also stimulate the anterior fornix or the A-spot, you can get an A-spot orgasm. If you stimulate the posterior fornix, you can get a what? An O-spot orgasm. And if you stimulate the opening of the cervix, then you would achieve a cervical orgasm. So these are the main areas that you need to take note of. The rectum around this particular area also has an amalgamated nerve endings, sometimes making that area very sensitive. And the reason why some people would like anal sex and find anal sex pleasurable, or when they insert the douche, it makes the place sensitive and can cause extra stimulation. But then, on a health point of view, you would need to be very careful because of the risk of infection. So this is the G-spot. So in conclusion, how can we achieve orgasm? And when I say how can we achieve orgasm, I have to be very specific with it. As for males, whether you like it or not, they will reach an orgasm. But for females, they may not reach an orgasm, which is the peak of the excitement. They will get excited, but they may not reach the orgasm. And so in order for you to reach the orgasm, you need to know your partner by foreplay. Foreplay is very, very, very important. If you neglect foreplay, the woman would not be stimulated enough. Take note, the chart I showed you about the sexual cycle, if the stimulation is high enough, just by foreplay, the slightest penetration or the slightest stimulation of the clitoris can cause the person to increase the excitement and then reach orgasm. But very importantly, you do not need to focus only on one particular area of the female's body. There are some men who like just the breast and they play with the breast to the neglect of other parts of the body, like the ears, like the back, like the hair, and all of those other parts, because all of those other parts brings about extra sensation and increase and makes the person likely to have an orgasm. If you focus on only one part of the female body, in fact, you may even be likely be having a paraphilic disorder we call partialism. And partialism is focusing on only one area of the female body, partialism. So number one is to ensure that you have enough foreplay to keep the person excited or reach the plateau phase, so that the least penetration and thrusting you will do would make the person to have what? An orgasm. And then once you are thrusting and you notice that the sensation in the woman is beginning to increase, make sure that you hold on and stay on that particular spot, that is causing extra sensation. Stay in that particular spot, increase your frequency and rhythm, and then the person would get an orgasm. But you have to be careful in order not to come before the woman. And so if you want to delay your ejaculation, take note of the 3 to 5 seconds prior to your ejaculation. That point is very key. And what you can do is to decrease, because you only ejaculate or you reach the peak of orgasm during stimulation. And so if you are stimulating and you notice that you are about to reach orgasm and you decrease the stimulation, it takes the orgasm back. And when you do a pineal plethysmograph, one would notice that the sensation decreases. So you can do that. You decrease your stimulation, you either remove your penis and then squeeze the tip of the glans penis, and then ejaculation will delay and then you will continue. Also note that ejaculation or orgasm, this area, it is noticeable in the cortex, where we have the genital or the sex stimulating area of the cortex. And so that is the place that would make you feel how do I call it? Feel the most excitement, and you are able to interpret whatever is happening. And if you are able to let and help a woman to reach orgasm, there are other neuropeptides and hormones that are released, like oxytocin, that even makes the woman to love you more. And like they always say, a woman who is really in love with you, or a woman who you help to reach orgasm, is likely to release oxytocin, and that oxytocin increases the bond between the woman and yourself. And such a woman will not cheat on you, will not go out to go and look for sex elsewhere. And the love and the bond that you would continue to have would increase. So, ladies and gentlemen, I would want to end here. And thank you very much for the audience. Over to you, Mr.
Thank
Host.
you very much, Dr. E.A. Today is the first time I got the full name, Dr. Senior Assistant. Thank you very much. I'm sure every single person will admit that you are an expert, an authority in this area. Everybody, if you agree with me and you've learned something new, put in the chat box. I have learned something. Just put it in the chat box, something new, or type anything in the chat box to show that you've learned something new. I have learned a lot of things. How about you? Put in the chat box. Let's get interactive as we wait for questions and answers. Put in the chat box, anything you want to type at all. I have learned a lot of things. How about you? He is the right guy for the topic, and he is delved way into it. Most of my questions that I had have been answered, and I'm sure lots of your questions have also been answered, but still, it's time for questions and answers. And lots of people were asking me, some were even asking me privately, Doc, is this session recorded? People kept asking me, Dr. Azuzon, this is in high demand. People want to go and listen again. So the good news is, yes, the session is fully recorded, and I'll be posting the recording in a few minutes after we end the session. So it's going to be on my YouTube channel. So the few of you who have not subscribed yet, please click on the link in the chat box on Zoom link, and then just subscribe to the YouTube channel and put the notifications button on. Now it's time for questions and answers. Dr. Azuzon, I have a question for you. First question.
Yeah.
My question is, are there women who do not and cannot achieve orgasm?
Yeah. So just like, when you talk about the anatomy and physiology, there's a whole range of variation in it. So yes, there are some women who cannot reach an orgasm. However, if you understand the physiology and the dynamics of sex, all women will definitely have sexual excitement. You understand? And so the sexual excitement, you can increase the peak of your woman. You get what I'm trying to say? The person may not have the orgasmic seizures. The person may not sweat, but the person would feel more pleasurable and enjoy the sex. And when I was showing you the sexual cycle, there was a phase of resolution. Unlike in men, in which the phase of resolution drops suddenly, in women, it is slow. In women, it is slow. Men, this is the C is how it happens in men. So once they reach orgasm, it and then drops suddenly. But for most women, it is slow. And so the phase of resolution is very slow. So if you understand that a woman who has finished having sex resolves slowly, when you finish, you don't get up and go to the washroom. It is key. And take note, oxytocin has been released, and that is the period where the bonding can even become stronger. So it is important that as the woman is resolving from the sex, you continue to do your stimulation. And this is the point where you need to begin to talk to the woman and laugh to the woman, because at this particular point in time, it's physiological. And there are a lot of chemical changes around that particular point in time. If you tell the woman how you love the woman, that is the thing the woman would forever remember. But if immediately after the sex, you say, but is that all? The kind of comments that you would pass to the woman can unmake the woman and make the woman not even have the desire to have sex with you anymore. So take note of the resolution phase. Yeah.
Okay, thank you very much. Okay. All right. So if you have any questions, please put it in the chat box in the comment section.
Someone asked that in the chat box. That's the
whole.
whole.
I'll be reading them out to you. I'll read them out to you.
All right, all right.
So if you have any questions, please put them in the chat box in the comment section, and Dr. Azuson will gladly answer all your questions. By this very beautiful, detailed presentation, one of the audience is calling you Dr. Orgasm. I don't know if you'll accept it. Yes, he's calling you Dr. Orgasm, and I'm sure a lot of people will agree. But before the first question, somebody asked, does a woman's orgasm depend on her or her partner?
Yes. So I am sure that those of you who were following the lecture from the beginning would be able to answer that question, that the orgasm of a female depends on both partners. You know, it depends on both partners. If the female is receptive enough and allow the man to touch the right areas, then the female can reach orgasm. Then again, men, by our paternalistic and chauvinistic nature, think we know it all. And if you are having sex with your partner and your partner moves your hand slowly, trying to direct you to touch a different place, please, that is a very important nonverbal cue that you have to take note of, because you are having sex, first of all, to satisfy the woman and not to satisfy yourself. And the woman, on the other hand, is having sex to satisfy the man. So if you understand this principle, that the reason I am having sex with you is to satisfy you, then you would allow the woman to lead and not think that you know it all. And if the woman says she wants doggy or she wants you to turn, all you are focused on is the suhum sawam, suhum sawam. No, it is not only suhum sawam that would make a woman to come. It is touching the right spots. And who knows the body of the woman other than the woman herself? You understand what I'm trying to say? So yes, the orgasm is dependent on both partners, and genuine communication after the sexual encounter is very, very important. So you know the areas that you have messed up, the areas that you can improve. The woman tells you that I want you to touch my toe, please touch the toe. And don't say that I don't like the toe, and so because of that, I am not going to touch the toe. The woman wants you to blow hot air into her ears, please do it. Nibble the ear, nibble the air, the hair, the small hair. And for men, the woman can also pull the hair around the chest slightly. All of these things increases the perception of sexual sensations. Yeah.
All right. So the next question is, a woman who sleeps after sexual intercourse says she's had an orgasm. Is that true?
Please take the question again.
Okay, this is how the person is put it. The person says, a woman who sleeps immediately after sex, does that mean she's had orgasm? No,
that's not what it necessarily means.
Okay.
Usually after sex, sex stimulates sleep. And so usually after sex, the person has a sense of relaxation and is able to sleep better. So it is not necessarily that because the person slept immediately after how do I call it? After sex, it does not necessarily mean that she had an orgasm. And that is why most of the time you will notice that a lot of men immediately after sex, they want to sleep. It's not just only because of the tiredness from the sex, but it is also because of the relaxing hormones and the sleep-inducing hormones that have been released that makes the person sleep. All right, there's a question in the box that says, does a full urinary bladder delay ejaculation in males? Yeah, so no. Usually after sex, there is a release of ADH, antidiuretic hormone. And that antidiuretic hormone would make the person not even want to urinate. If you were feeling like urinating before sex, let's say if you are the woman or the man, you felt like urinating before sex, and then you think that because you felt like urinating, you are going to come quickly. No, it is not true that you would come quickly because you have a full bladder. There is really no relationship with that. On the contrary, it is after the if it's immediately after sex, ADH spikes, and the spike in ADH actually makes the person not want to urinate. But we advise that women, especially, both men and women, you try as much as possible to urinate immediately after sex, because as there is the trusting, there are some parts of the urine in the urethra that seeps into the vaginal canal. And so it is important, and how do I call it? The trusting also causes some small tears around the vagina. The tears may not be so much. And so it is important that you urinate because of the seepage of sperms and some vaginal flora that may go into the urethra. And so it is advised that women especially, they urinate in order for some of the flora in the vagina not to go into the urethra and the bladder. And because women have a short urethra, it is easier for the sperms and some vaginal flora to go into the bladder and cause a urinary tract infection. So it is advised that you urinate after sex.
All right, thank you very much. Somebody is asking, does pregnancy reduce a sexual sensation?
In fact, pregnancy increases sexual sensation, and it is only pregnant women who are always ready for sex and do not actually even need extra foreplay or stimulation before they how do I call it? Before they have sex, because a pregnant woman's vaginal canal is almost always opened and is almost always wet. So even if your partner is lying down, she is pregnant, it is easier for you to slide it in, and it will go in quickly as compared to a woman who is not pregnant. So pregnancy increases stimulation for sex, and it increases the sensation and the feeling that you get from sex. It does not decrease it at all.
All right, thank you very much. Lots of people are just happy about how illuminating the presentation has been. If you have any questions, please put in the chat box in the comment section right now. Dr. Susan has some few minutes with us to answer all our questions. Dr. Susan is available to answer all our questions. If you have any questions, please put in the chat box right now. Dr. Susan will gladly answer you. As you can tell, he is an authority. Please put your questions in the chat box and let him answer for you to get full clarity. This is a topic that a lot of people do a lot of hash on, but a lot of people are also suffering silently. So it's good that we are here listening to an expert who knows what he's talking about. Thank you very much, Dr. Susan, so far. If you have any questions, I'm sure because the presentation has been quite detailed and very illuminating, a lot of questions have been answered. I was going to ask you about the female ejaculation and the constituent of the fluid, and you answered it before. So it was like, most of my questions were shut down during the presentation. Yeah, a lot of people were arguing it's urine. Some say it's not urine, but we know it is a mixture of urine and other fluids as well. But I will ask again in that regard, how common is female ejaculation among the Black population, African Black population?
I am not really so sure of the statistics vis-a-vis ethnicity, but ejaculation in general is less common in females as compared to males. I am not too sure of the population, but then again, there are some school of thought that say that the vagina or the female reproductive system is the same, irrespective of color, irrespective of height, irrespective of whatever, unless the person has a genetic disorder that has caused a change, and in that case, it will be a defect. If not, the reproductive system is the same everywhere, but you have minor variations in the presentation of the vulva and in the presentation of the clitoris. Just like some people have big heads and some have small heads, some have big clitoris and others have small clitoris. And because the clitoris has erectile tissue, it is like a muscle you are gymming. So the more you stimulate it, the more obvious and conspicuous it is. And it is the same for the penis as well. So a person who has not used the penis for a very long time likely to suffer atrophy of the penis. But the more you use and exercise the muscles, the more it stays as it is, and the more healthier it is. And as a matter of fact, research has shown that men and women who have sex at least 2 to 3 times a week look 5 to 7 years younger than their counterparts who do not have sex as often as they should. Yeah.
All right. Now, there's a question that somebody has sent to me. It's asking that, what are some of the techniques you will teach someone who has premature ejaculation?
Yes. So, like I said, if someone is having premature ejaculation, usually we would want to take a history, a comprehensive sexual history, to determine where the problem is. Is it which stage of the sexual cycle is there a problem? You notice in men, once men are in the excitement phase, if the excitement continues, there is sometimes a release of the seminal fluids from the Cowper's glands and the seminal glands, where you will see as the precum. And any small hole or tightening of the penis around that particular period of time can even cause the person to ejaculate even before he enters into Israel. You understand what I'm trying to say?
Oh,
so yes, so that is what sometimes can happen in people. And so it is important to understand where in it does it happen. You get it? Yeah. And then, but if it is purely as a result of just in orgasm, what we would advise the person is that, I would always say this, that the most important muscle in a man is not the pectoralis. The most important muscle in a man is not the biceps, neither is it the triceps. Okay. The most important muscle is the pubococcygeus muscle. That is the hammock that holds the root of the penis. And it is that contraction that causes the spurt of the ejaculate. And so if you have a strong pubococcygeus muscle, you can sense ejaculation before it comes. Once you are able to sense ejaculation before it comes, you can decrease the stimulation. Take note, ejaculation occurs as a result of extra stimulation. So the stimulation continues to go up until it reaches a peak, and then the person releases. So once you are able to sense that you are about to reach that peak, you can hold it with your pubococcygeus muscle. A practical way to know this is a man's ability to be able to hold urine and squeeze the penis from and prevent the urine from coming. That muscle that you use to hold your urine is that particular muscle that would help determine whether you can delay ejaculation or not. And so techniques that we usually teach is what we call the Kegel exercise. And this is the goal of the Kegel exercise, to strengthen this particular muscle. So anytime you are going to urinate, you can try to see if you are delaying the urine and hold 3 seconds and release 3 seconds, hold 3 seconds and release 3 seconds. Do that for 5, then gradually increase to 5 seconds, gradually increase to 10 seconds, in that order, exercising your pubic oxygenous muscle to ensure that it is strong enough. Then again, we have the squeeze technique, where in the squeeze technique, you would, once you notice that you are about to come, you hold and squeeze the glans penis. Holding and squeezing the glans penis decreases, this is the physiology behind it, it decreases the extra stimulation that you are getting, and then can push the sperms back into the epididymis in order for it to be released. These small techniques can delay ejaculation. And once your penis is inside the vagina, ejaculation is more or less bound to come. So if you remove it and immediately start to think about Manchester United losing against Brighton, it causes a decrease in stimulation. Right. It causes you to feel less pleasurable. This less pleasurable sometimes can cause the penis to become slightly flaccid. Once it is becoming slightly flaccid, then you go in again and continue. Another technique is what? To change your position. In the process of changing your position, you are not inside. And so this process delays stimulation and decreases stimulation. All these techniques are very important in delaying ejaculation. And as a matter of fact, you can go 1 hour, 2 hours without needing Viagra or needing a lawyer.
All right, so somebody is asking a question. Is there something like having too much sex? For example, if he's having sex every day, would you classify that as too much? And the follow-up is, how often should he have sex to stay healthy, like you described?
Yeah. So in fact, yes, there is something like too much sex. Then I would want to throw the question back. Is there anything like eating too much food?
Yes.
It's relative. We cannot really quantify and say that this person is having too much sex or this person is eating too much food, because the amount of food that Sodonia can devour may not be the same amount of food that Jude would eat. And it is the same with sex, that the amount of sex that a person is having may not necessarily be the same as the amount of sex another person is having. So there is really no limit to the number of times that you can have sex. However, ICD-10 and DSM has a condition for sexual dysfunctions in which the people have too much sex. In men, it is called satyriasis, and in females, it is nymphomania, where the person desires and wants to have a lot of sex, but does not have a consensual and willing adult partner to have the sex with. In such an instance, then you can describe it as what? Having too much sex, because it is going to be dependent on your partner, and it is also going to be dependent on how it is impairing your functioning, i.e. social, occupational, and family functioning. So all of these things will be considered in order for us to actually say that a person is having too much sex or a person is not having too much sex. So the person who asks that question, if your husband wants it daily and you can provide it daily for your husband, if that is going to make your husband happy, please provide it to your husband daily.
All right, good one. Now somebody's asking, does a woman feel pain when you withdraw and re-enter?
Yeah, so like I said, if you look in one of the cycles I showed you, in this particular cycle, So if you look at the blue one, a woman goes through excitement, can reach orgasm, and then begin to decrease again. During this particular period, is slightly of a refractory period. And during this particular period, the woman may begin to start getting dry because she has reached the peak and it is coming. And so once you remove and you are re-entering, you have to start slowly again and be careful and enter slowly. Because if there is not enough lubrication, then it can cause vaginal tears. Someone asked me a question that, how come when you have sex with a woman, the person gets vaginal tears when the penis is round and doesn't have blade or sharp edges? Where are the tears coming from? You get it. The tears are coming from the rugi. The tears are coming from the rugi and the friction that occurs during this particular period. And this rugi is very important for us to take note of. As a person ages, the number of rugi and the roughness of the rugi decreases. And so you will find out that in teenage women and early adulthood, they have a higher amount of rugi that can cause more friction and more sexual excitement as compared to their aging females. On the other end, men have their peak sexual arousal and excitement during their teens. And research has shown that it is at age 17 years. And that is why if a man is able to control his erection during this particular period, then the man can go far. But if you're unable to control the direction of your erection, then failure is likely imminent. Because during this period, your sexual urges are at its peak.
All right, thank you very much. Somebody's asking, let me just make it a broad question. The absence of sex, does it have any physiological changes in either male or female? For example, somebody who is staying celibate for life, does it have any negative effect on a person?
So, no, it doesn't necessarily, because if you notice, every man who is not even having sex gets erections. Every man gets erections. The erections are enough to keep the person. You understand what I'm saying? And the peak of the erections are usually around 4 a.m. to 5 a.m., where there is a peak in the hormone testosterone. And that is where you would usually see tumescence occurring and happening. Then again, if there is a buildup of sperms in the epididymis, this increases the person's tension and urge to want to have sex. You would feel it. You would feel the urge. You would feel it, and it is tensious because you have accumulated enough sperms in your epididymis that needs to be released. Some of the sperms sometimes is reabsorbed into the body and converted back into the amino acids and glycerides that we get. But the majority also still needs to be released. And that is when you begin to have the urge for having sex.
All right.
God being so wonderful and our body being physiological and wanting to maintain homeostasis would cause you to release this during your sleep. And so you would notice that the celibates for the men, even if they do not have sex, they release at night, or better still, what we call bedwetting. Some people will do it in dreams. Others, it just occurs even without daydreaming. For women, on the other end, it's been shown that sex decreases some cancers, breast, ovary, endometrial, and then all of those things. But we do not have enough studies to show that there is actually an increase, or it is so strong that if a woman is having, I mean, not all people who have abstained from sex end up getting all of these cancers. That notwithstanding, sex is still very important for the physiological well-being of man and woman. And that was why God himself instituted it and created it and said, let us multiply and fill the earth through what? Sex.
Dr. Orgasm, there's a question. The question specifically about men is asking, does regular sex have any benefit in terms of prostate health?
Yes. Very excellent question. I thought I said it, but then, so if you look at this is the prostate. This is the prostate. And during ejaculation, the prostate also releases some sperms. Not sperms, some fluids. And then the prostate what? Contracts. Studies show that a healthy prostate, or having sex 2 to 3 times a week, helps in keeping the prostate healthy. That's what studies show. But that does not mean that if you do not have sex, then your prostate can become ill. Not necessarily. But then sex helps to improve the health and functioning of the prostate.
All right, thank you very much. Thank you. Somebody's asking, just for emphasis sake, and for those of you who join us late, please, the recording will be shared so that we don't go back. The recording will be shared, so you just have to subscribe to the channel, and then you will gladly get alerted once you put the notifications on. When I post the recording in few minutes after we are done, I'll post the recording for you to get access to. So I've shared the YouTube link again in the comment section on Zoom. Click on it, just 3 seconds, click on it, put the notification button on subscribe, and you have access to all of it. Somebody is asking, are there any physiological reasons behind or that explains pain during sex in women?
Yeah, so there are a lot of factors that account for that. The first one is a woman who is not ready to have sex. It's not prepped enough, it's not wet enough, and so the person would be dry and cause pain during sex. The other thing too is if the woman is having a very small vagina and the penis is very big, it can fill up the entire space of the vagina and cause compression on the nerve and cause pain. Another thing too is what we call vaginismus. And vaginismus is involuntary contraction of the vaginal muscles. The cause is unknown, but there are certain risk factors, like somebody who has had, sexual abuse before is likely to have an increased chance of getting vaginismus. In some people, anything that goes into the vagina would cause it to contract, and so they would continue to have pain. Then again, we have dyspareunia, and dyspareunia can be functional or it can be organic. So these are some of the things that can cause someone to have pain during sex. And so once you notice that you're having pain during sex, it is important that you see your doctor and for the right investigations to be done. If it is done and we notice that it is not anything organic, then that is when you see some of us, because it is psychological and you would need help in that particular regard.
All right, so somebody is asking, some men report of delayed ejaculation and some don't even ejaculate at all. Are there causes?
Yeah, so there are causes of delayed ejaculation in men. Some people just even do not have the sperms at all to release it, and we call that dry ejaculation. So they notice that they are continuing to have the sex, but then they cannot even release at all. The psychological bit which I would want to hit on, because that is my area, is the fact that a man who is not interested in the partner that he's having the sex with may likely have a delayed ejaculation because the brain and the mind is not even ready for it. And erection may not even be strong enough. And because of that, the person may not be able to ejaculate. Apart from that, there are also medical and surgical causes of delayed ejaculation, which I would want to leave for the urologists and the gynecologists, because that is not my area.
All right, thank you very much. Somebody's asking, does masturbation have any effect on one's sexual drive and performance in bed?
Yeah, so in fact, studies, interestingly, there's a study that shows that married couple masturbate more than single people. Masturbation can help in enhancing sex, as if you immediately masturbate before having sex, there is a chance of you delaying your ejaculation. And this is akin to someone having the first round of sex. The second round of sex is likely to delay. And so that's one way in which masturbation can help. Secondly, masturbation for both men and women, especially for women, it helps the women to know how they want their men to satisfy them. So it helps them to explore their own bodies so they can teach their partners to do that in order to satisfy them. And so if you masturbate in the name of trying to explore and to know about yourself and to teach your woman, obviously it will, and to teach your partner, it will enhance the process of pleasurable sex. But masturbation can also cause a person to have premature ejaculation, as the person who continuously masturbates gets used to the masturbation with the hand. And therefore, any other thing like the vagina that would cause stimulation would make the person to come early. The other thing too is that people who tend to have the tendency to masturbate do not enjoy sex, and they may become addicted to the masturbation. And once you are addicted to the masturbation, that is another ball game and goes into a different dimension of therapy.
All right, thank you very much for that elaborate. So it means it has negative and some few positive
yeah.
well. But from what you are saying, the negatives outweigh the positive. Would you say that, Dr. ORGASM?
It is, it's dependent,
Okay.
Like I said, it's dependent on the person.
Don't worry, let me not push you.
Yeah, you don't have to push me, because if I masturbate for my partner, it's beneficial.
Yes, I get your point. So I don't want to push you in that regard at all. Those of you asking if it's going to be recorded, please, yes, it will be shared on the YouTube channel. Just subscribe to the channel and you have the full presentation. Trust me, you want to listen from beginning to the end. He's delved into everything you want to know about orgasm. And unfortunately, like he said from the beginning, there are over 70% of women who have never achieved orgasm. Some women have given birth to 5 children, 6 children, and they don't know what it means to have orgasm. Some are not able to have orgasm with particular partners, but are able to have it only particular partners. Most likely, it's a matter of technique, and that comes from knowledge and application of the knowledge. That is why we are all here to learn. So thank you very much, Dr. Azu. Anyone else has any question to ask? Somebody saying, Doctor, God bless you. Azu, you're making people bless me. They say God should bless me. Anyone has any question? Anyone else has any question? If you missed the beginning, please wait for the recording and you would enjoy it. Trust me, it's good. You can listen together with your partner and you both learn together and execute as much as possible.
Someone asked about how to do the clitoral stimulation.
Yes, so you can go over it again, please.
Okay, so it is important. If you know the areas of the clitoris, you would know where to stimulate. You will know where to stimulate. And so this is the clitoris. So if you are stimulating the clitoris and you focus on only the part that is visible, obviously you are missing the boat. Look at all this, part. About 80 to 90% of the clitoris is not visible to the external eye. And so if you start stimulating the clitoris, you first of all have to start slow and do a back and forth, front and back. Slowly, as you do that, it's like there is really no difference stimulating the clitoris and stimulating a man, or giving a man a blow job or a hand job. You start slowly, but in this case, you use your fingers. So you start slowly, back and forth, slowly, back and forth. With time, you observe your partner, the changes that your partner is making, the sounds, the moans, and the groans would let you understand the level of perception or the level of sensation she is feeling. Then again, you look out for the shaft of the clitoris. If you touch the clitoris, you would know how the flaccid clitoris is. And you would, if you are used to it, you would know how the erect clitoris is. So once you find that it is now erect, you can then go in deeper and locate it on this side. So this is only can you see my cursor? This is only the part that is visible. This is only the part that is visible. And so imagine focusing on only this part and stimulating it like this way. If you are stimulating it like this, you are missing it. If you do it this way, you are missing it. But if you go down and try to get the shaft and stimulate that area as well, it increases the sensation that the person is feeling. Then you can put your index finger around this particular area, and then your thumb at the top, lift the clitoral hood slightly, and then do it like in a back and forth motion, like that. And it will give your partner a type of orgasm that she has never experienced before. Do that, and your partner will continue to say, Mura, in fact, you are the king and you are the organ.
Mr. Nobo Agbakpesem, I should tell you that thank you. And God bless you for showing him again a proper way of clitoral stimulation. Please, all of us on the call, I couldn't have gone without noticing the presence of one highly revered personality amongst us. And it's quite impressive. And I'm humbled to say that this highly revered personality joined the call very early and has been on till now. Please, he is the highly revered, well-known, globally acknowledged former CEO of Mental Health Authority, Professor Akwesi Osei. He is on the call. He is our lecturer, he is our mentor, and he is here. We are all humbled. And I don't know how Azu is feeling talking about clitoris, right? Professor.
I am very humbled, and I'm so excited that Prof is around. Prof is our teacher. And I want to say that I stumbled into this by chance. I bought the Kaplan and Sadok, right?
Yeah.
The comprehensive one, the big one.
Yes.
And to my shock and dismay, there were like 2 whole chapters
on this.
2 whole chapters, Dr. Sedun here.
Yes.
On normal sexuality, sexual dysfunctions, paraphilias. And I'm like, hey, so we psychiatrists, what are we missing? There's a lot that we are not doing. And it is very important that we push this agenda to let people know that we are not all about schizophrenia and bipolar.
Yes.
And that there is more to psychiatry than the eye can see, just like the clitoris.
Yes.
So I'm very happy that our our father is on the
Yes.
call.
He's even our great grandfather. He's our great
Yeah,
grandfather.
I mean, our great grandfather.
So, Prof. Akwesio said we appreciate your presence and we salute you and we thank you so much for all you do for the mental health fraternity, and we salute you so much. Thank you. Anybody have any final questions? In 5 seconds, as will be giving us his final remarks, and we will be out of it. The recording is going to be highly sought after, so just give me some few minutes after. I will do some few touches and I'll post it and share, subscribe, and have more people to benefit. We need more people to have and hear from experts on the field, not just anybody saying anything that they want to say. Without any question, Azu, please give us your final remarks.
Yeah, so first of all, I would want to say thank you very much, Dr. Sidinha, for hosting me and for giving sex a chance. You know, you have always been doing this every week, and you've given the opportunity for sex people to also hear about a well-known area in sex. And so I just want to also encourage every other person who is listening to subscribe to the YouTube channel. And there are a lot of educative content on the YouTube channel that you can listen. And this is done every Saturday. So just follow the subscribe to the once you always get notifications anytime. And I would want to say that I really do not understand why sex is denigrated to the background. It is that one thing that everybody likes, but nobody wants to talk about it. I want to change that mindset among Ghanaians and among people in the world, to make sure that everybody has proper sex, enjoyable sex with their partners. And that is why I am so interested in this particular area, and I would want to push it as much as I can. And so to everybody on the call, please find time to educate yourself on sex, and do not assume that once you are an adult male or an adult female, automatically when you marry, you would know how to have sex. No, nobody gets up and learns and knows how to cook banku or fufu by default. And that I would want to end with these words, that the act, ACT of sex is an art that needs to be learned. Thank you very much. I rest my case.
Dr. Orgasm, the name has now been conferred on you officially. Officially, we are conferring this name on you. You are Dr. Orgasm. Now, with this splendid presentation, we will be inviting you back on other sex-related topics for you to educate us more. Now that we have confirmed and are so sure that you are an expert and authority in this area, we will be inviting you to teach us more. Thank you very much, Dr. Emmanuel Atue Senior Azusong. Yes, I got the full name right. Thank you very much for making your time and making the presentation very practical and very, very, very relatable. Thank you so much. And to every one of you on the call, making time to participate, we appreciate you so much. Those of you who join us late, please, the recording will be shared on my YouTube channel. Feel free, go there. There are a lot of other educational presentations as well. We are all about educating people, allowing people to hear from the experts. We should stop listening to hearsay. People who don't have the right to speak about certain topics should not be listened to. We prefer you listen and hear from experts. Thank you very much. Until I come your way once again, it's been Albert Seddon here on the Weekend Health Talk. And once again, it's been a plum, pleasing pleasure serving you all.